Friends, I am Dr. Nirmal Surya, Neurologist and Trustee of Epilepsy Foundation working at Bombay Hospital. The epilepsy is a problem, as you are aware, and it affects 1% population. Today, in the era of COVID, how the epilepsy is being seen or how it's being perceived, what are the problems with those who are suffering from epilepsy. And I just want to highlight that people with epilepsy has been affected in a different way. There are patients who are presenting as epilepsy with the COVID infection, that is one way. But those patients, whether there can be a precipitation of seizure because of the fever, who are suffering from it, we really do not know. There may be an increased risk of fever-induced seizure, we do not know. There is also HCQ is known to increase the risk. So if the patient is going to receive the HCQ or if they have been receiving as prophylaxis, will this also increase the risk in this epilepsy patient? We don't know. There are not many evidence. But what is the most important thing is that today, because of the lockdown, the patients are not able to go to see their doctors. So even those people who are well controlled, they are not been able to get the medicine what they have been taking regularly, because one is they are not getting the prescription. Two, wherever they are staying, nearby they have to search for the medicine, and some of the medicines may not be available in the remote area or in the suburbs or where they are staying. The smaller shop may not be having drugs like lacosamide, drugs like levetiracetam. So these are the problems they have. Now, I have requested the government of Maharashtra Health Ministry 3 weeks ago that they give a direction to the Maharashtra medical shops that those patients who are epilepsy and they have a prescription and whatever medicine they are taking, and if there is no doctor to rewrite the prescription, they should be allowed to continue the medicine, and the medical shop should provide them medicine till the lockdown is being out. So that's one request I have already sent about 4 weeks ago to the commissioner, because all over Maharashtra, not only in Mumbai, the people have been facing this difficulty. Now the online medicine to supply also has been difficult because most of the couriers have stopped. There are some apps do provide, but Mofussil area and in the remote area, the people do not have access to this. So these are some of the problems we have been doing is past 15 days, 1 to 2 o'clock, we have been seeing the patient so that if they have any problem, they can discuss, because many of these patients dropping the medicine and their seizures are getting precipitated. And some of the emergency patient who really has problem, we have called them to consulting and to the hospital to treat them. So in this particular situation, people with epilepsy who has to take regular drug and they need a regular prescription, and some of the medicines which are not available at regular chemists are facing a difficulty, and we really need to address those difficulties. Thank you very much.